I dreamed of this moment for so long. I used to lay on my back just like this, just so my chest could go off to the sides and allow gravity to open the brown sea so I could look flat, you know what I'm saying? And now it's like came true.
Good evening. I would like to thank you too, yes you too, for hanging out with me for all these years. You get it? Hanging out.
We got a lot to cover, peoples. So get your notebook, open your minds. Thanks to everybody who submitted a video, allowed me to use a video. Any questions along the way for a specific person, or all that, put that down there. Alright? Let's get started. Alright, so first things first, why would you want to get top surgery?
This surgery, what it would mean to me is that I would get my life back. I would get that part of my body back, and it would mean the world to me.
Do you have to start T before you get top surgery? I know for a fact there's a few people who've had top surgery who is not on T. Personally, I would suggest T. It's a moment to get to know yourself and make sure that you are ready for the changes to come. Like, you can get on T and decide, oh, this ain't for me, and stop. But surgery? No. How did people choose surgeons?
To be quite honest, what I did was I did a lot of research, Googled, and most importantly, YouTube. YouTube was my best friend. I saw a lot of results, which made my decision with Dr. Garamoni.
If I had to give any advice for top surgery, I would think my biggest thing is do your research on different surgeons. Just because a surgeon is not well known doesn't mean that you'll not get the results that you want. I went with someone in Georgia that hadn't done as many surgeries as Dr. Garamoni has or Dr. Medali has done, but he had the results that I wanted for my body type, and I think that's important.
I was like the little kid who saw somebody else with it and was like, ooh, 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 I want that. My homeboy got his chest done. I said, ooh, how you do that? That's how. And I said, oh, I want your surgery. So how did I go about setting up my appointment? I first went to the multi-specialty transition clinic, I think that's what it's called, in Oakland. And I went there and I talked to this person. I actually talked to two of them. And they asked me a whole bunch of questions about my life and my childhood, how I felt about the transition in my body and stuff like that. And I guess they just kind of ask you a bunch of questions so they can get to know you. And if they feel you are ready, they write a letter of recommendation for you to have a consultation with your surgeon. Yeah. So how do people pay for a procedure like this? I went through Kaiser. So I basically didn't have to pay anything. The visits and the medication. Probably about $50. Alright, so for cats who's not using the insurance, I was quoted $8,280 with Dr. Crane in San Francisco. And I had to pay a $500 non-refundable fee to set my actual date. And right after I paid my $500 non-refundable, my homie told me about the Kaiser situation, so I was like, ugh.
3 weeks before your surgery, you have to pay Garamoni's portion, which is $4,700. The $1,700 for the hospital and pathology fees isn't due until I think you're pre-op.
There's a lot of sites on here where you can set up an account to do fundraising.
I need help getting a double mastectomy with chest contouring. The quote I have for $12,514 is from a private clinic in Nova Scotia.
If you're gonna have top surgery in the near future, research. You cannot say that enough. Research. But at the same time, know that everybody's not the same. You know, things might just go a little bit off for you. But this is me. About a week before your surgery, or maybe a few days, start getting your diet right. You know what I mean? So your stomach, you don't have stomach issues. If you upstairs and downstairs like me, set you up a table with everything you need so you don't have to move a lot. Have stuff right there. Just like right there.
Just picked up all my things from my surgery. Dr. Linsenberg prescribed me Lazopram, if that's how you pronounce it. It says here, this is for anxiety. I take this the day before surgery, like a nausea patch. This on the night before, and I can wear this up to 3 days for nausea. I'm getting a little nervous. It's 6 days away.
Knowing that in 4 days, a piece of this shell is gonna come off. And it's scary in a way, knowing that I'm almost gonna be out of my comfort zone, even though I'll be more comfortable. Knowing that this summer, I'm gonna be able to have my shirt off, and I don't know how I'm going to act. I don't know what to expect with this new level of comfort that I'm gonna attain by having the surgery.
Take me to the airport. I'm really nervous. Nerves are kicking in.
In the morning, I'm having surgery. Actually, I will be headed to the surgery center in like 12 and a half hours. Quick little drive, and then it's just wait to get knocked out and have surgery. Yeah, it's exciting.
How you feeling?
Awesome. My biggest fear was I was gonna die. I'm serious. I was like, oh my God, this is probably the last time I'm gonna see the light.
This is the morning after. What an experience. All the things that I never heard about from people talking about this surgery, I now know. And it was rough. Like, it's pretty painful. This thing here, it's real tight. Beyond tight.
They ain't lying, man. You really feel constrict in this wrap, and you can't breathe. It's hard to breathe. Literally, it's hard to breathe. You wake up from the anesthesia, and you're like, ugh.
Any pain that I'm feeling for the most part is just from this thing being so tight. Like I woke up this morning and my ribs just hurt because this thing is like wrapped around you like 12 times and it's super tight.
One day post-op, it's hard to stand straight because of just everything. Swelling here, and because of that stupid ace bandage.
Here. The only problem I have is my stomach, is the constipation.
Like, it wasn't pain from the chest and all that. I had bathroom issues. I could not go boo-boo. I was in there sweating and shaking, and I was in pain. It was horrible.
I think my surgery was about a little bit over an hour. I think I left around 5. I guess they were having a hard time waking me up.
I woke up in like 15 minutes, which was weird because they usually don't wake up until like an hour and a half to 2 hours after.
Alright, so let's go through it. The best and the worst of throughout the weeks. Boom, 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 boom. First week.
I got the drains and bandages off yesterday.
I don't know, maybe I did too much, but when I got my drains out, oh my God, it wasn't like it was like tug, tug, tug. Oh no, it's not working. Tug, tug, tug. And this big thing came out and baby almost passed out. I'm just saying, it wasn't easy to get them at. It helped me by taping them. I think when I didn't have it taped, I pulled them a lot, so I was constantly irritated at the drain sides right here.
2 weeks post-op.
I just took my first shower, and it was glorious.
First time he's washed his hair in 2 weeks.
Yeah.
I did not use a towel. I was scared I was gonna snag something. I literally used my hand, lathered up, and was like, I was scared. I was so scared.
You know, the first time I took the shower, I was really, really scared. Like, I'm scared to, I'm gonna scrape off my nipples. This tape right here is falling off, so I don't know whether to rip this whole thing off or just wait.
These strips, the doctor said, are supposed to come off on their own. They should come off before my next appointment in 2 weeks.
When can you go back to work? I went back to work because I have a sit-down job after 2 weeks. And that third week, I kind of half days, you know what I'm saying? But about 2 weeks.
If you have the strenuous type of work, like I'm a letter carrier, so I definitely needed the 6 weeks off.
6 weeks, a big deal.
The scars look really good. They're not raised at all. They're a little thicker here. But overall right here, like this is super flat. All of this is really flat.
Babe, I'm getting really pink right here. Like it's digging in. Like, so I don't put scar tape on there no more.
I have my scar guard on right now, the silicone strips that you put on to help with the scarring.
Pec, like where my pec stops on the right side, is flat before you get to the incision. On the left side, you see that there's like swelling between my incision, and I guess where my pec stops, you can't even see it because it's like swollen on this side.
It still kind of feels numb, like I can feel that I'm touching it, but
I started working out at 6 weeks, and I just sort of added and added every week a little bit more.
We'll be trying to go to the gym a minimum of 3 times a week. Today, when we go after she gets off work, will be my 3rd time this week. This is my chest 8 weeks post-op. I have the scar strips on it now. All the incisions fell out of the nipples, obviously.
At 2 months, I couldn't feel under here, but now I can. Let's talk about nipples. Papers, it's okay when your nipples start peeling. They supposed to do that. I did not know that at first. I was doing all I can to keep it on. You know what I mean? I kept tapping it back, and I was like, no, that's supposed to full of. Oh.
for the most part, they're flat. Like I don't have an actual nipple right now, but a lot of people say that usually, not usually, but sometimes changes. Sorry about that.
It's like smooth. I can't really feel an actual nipple. I mean, on this side, I could feel like a little dot. It's just now starting to get a little bit brown around the edges. Alright, so the doctor said that this could take anywhere up to a year to get actual full color. And some people actually some don't get it and they have to get it tattooed. Here's my nipples at 3 months. I still have a lot of pink to come, a lot of brown to come in.
My areola are both officially brown. My nipples are working on it.
This nipple, I think, is doing the best. He's not big of a bleeder. But this guy is sad.
On Saturday, I worked a really long day, and I had an undershirt on under my work shirt that I think was like a little too snug, probably. So I basically got like chafing on my nipple, and so it's almost like a fresh wound again. Basically, I'm just putting like Neosporin in a gauze and treating it like a fresh nipple graft.
The ridges on the wife beater, it irritated my nipple a lot. Basically, anything that touched them irritated them, but mostly like ridges. So nice smooth shirt.
I think is really normal in the way that the curvature is, where the nipple is. But on this side, you see that it does that and then goes down. And
if I lift right here, I can see it's concaved or dipped a little bit right here. I noticed that a lot of guys have that where it dips in this one spot, like there's like a pocket that just whoo. Let's talk about things that just didn't go quite as right as we planned.
I am about 12 weeks post-op, and it still hurts to like I can lay on my side, but then when I get up from laying on my side, it hurts.
One advice that I would give to other guys out there is listen to your doctor about not doing any strenuous activity within 6 weeks. Because I ended up with the hematoma. I ended up with a pool of blood right here. I ended up having like a uni boob right here, and I was like freaking out. I ended up getting rushed to the ER. I had to get it drained. It was like the most uncomfortable thing ever, man.
Let's talk about revisions.
The more I looked at it, I'm like, yeah, nah. I'm going to get my revisions done. I did decide that I do want to get my areolas cut and reshaped to a smaller size. Way too big. Like, I need a nickel size. Like, I need to go. The one that I did, they consider a keyhole. I got 2 puncture wounds, like, on the side. I call them my bullet wounds. Like, my areolas, they're too big. It's still a lot of swelling. He is going to do my nipples, my areolas, rather. So that's going to be smaller. I just need to get some muscles, and I'll be good.
I don't want anybody to be confused. No, I do not regret having my period. Yes, it could have been done a lot better. Yes, I could have went to somebody else that probably was a lot better at it. But given the fact that it was free and the options that I had at the time, it's very well, and it got me through 4 fucking years. Now, I'm getting ready to have my entire chest reconstructed. I've gained like 20-something pounds and lost some pounds and gained some more back. So the elasticity in my chest is not as good. I have a lot of extra skin now. On the right side, the crease never uncreased itself. No matter what I do, no matter how much work I put in, it won't go anywhere because the fact is it's missing fat in that region. I'm going to let him do a full double incision with correction of the nipples. He's probably not going to do too much to my nipple because it's always been male size, but I'm probably going to have him shave it down a little bit. My normal stance is like this, and now we start to see the problem. The skin here, I can literally do this. This side right here, we've always known this as the problem side. This is the problem child. When I flex, it destroys my contour. You win some, you lose some. Everybody has different needs. Over the years, my needs have changed. No fault of anybody.
Let's talk about scars.
Keep your scars out of the sun for at least a year. I first used what Dr. Garamoni recommended, which was the Scar Guard. I didn't like the smell. I also didn't like how it kept rubbing off my clothes and on myself. Then got Scar Away. It's like this little band-aid thing that you put on top of your scars. I don't know, I didn't really see any results from that.
It's the 1mm Scar Guard MD edition. It's just like a nail polish applicator, and you kind of just paint it on the scars. I do it at night after my shower.
So every day, one of these gets, actually every day all of these get massaged into my scars. So I guess technically I'm putting things on my scars 4 times a day.
Don't be afraid to ask for help and ask questions. Don't be too stubborn. Yeah, I would not have been able to do this by myself.
Thankful to my wonderful girlfriend for assisting me and helping me.
For those out there helping.
If I had to give any type of advice, the partner of an FTM and who might be about to have top surgery, being that everybody's situation is different, for me the key thing was to have patience. I had no patience before for things, just period. And going through this journey with Fatty has taught me a lot of patience. And the only other thing I would say is enjoy the high. Enjoy that moment where when they can look in the mirror and then you just see the smile come across their face because they feel like, I'm here.
Thank you guys so much for going through this whole video. Thank you again for everybody that helped me and everybody that's coming. Feel free to put your personal information down here because this is a source video. I want people to be able to look in the comments and get the information they want if they don't get it from the video. Till next time, peoples,